You're listening to ReachMD, and this is Lipid Illuminations, sponsored by the National Lipid Association. And I'm your host, Dr. Alan Brown. I'm here at the National Lipid Association's annual scientific sessions in Las Vegas, Nevada. And with me today is one of the top winners of the NLA's Young Investigator competition, Wang. Lee is a PhD candidate at the Department of Nutritional Sciences from the Pennsylvania State University, and she was mentored by Dr. Penny Chris Etherton, a former president of the National Lipid Association. She received her Bachelor of Medicine from Nanjing Medical University in China before she enrolled in the doctoral program of Nutritional Sciences in the Pennsylvania State University. Today we're going to be discussing her award-winning study looking at effective diet on LDL particle size. And Lee, thank you very much for joining us.
Thank you, Dr. Brown.
So tell us a little bit about the study. For our listeners who are not nutritional geeks, just tell us a little bit about how you designed the study, what you were looking at, and what you hope to find out.
Okay, I'm very happy to introduce our 2-year-long study on avocados. And this is a clinical trial. We designed 3 diets to feed human subjects. We have a low-fat diet, which is lower in fat, and 2 high mono diets. So they are high in monounsaturated fatty acids, and they are moderately in fat. So the 2 moderate fat diets has total fat as 34% of allergy, but the low-fat diet only have 24% allergy. So that is high in carbohydrates. And why are we doing this? Because as we know, like some studies shows Mediterranean diet is good, and some studies shows monounsaturated fatty acids is good, and we also have some controversy on this. But Mediterranean diets containing olive oil consistently showing benefits to population on cardiovascular disease prevention. And we also found from enhanced study, like in United States, the MUFA content, the high monounsaturated fatty acids content in the diet actually always coexist with saturated fatty acids and added sugar. Maybe we are not aware of that because we are not aware that the main food resource of MUFA in the Western diet is mainly from animal source in desserts, like dairy sauce. Yeah.
So you mentioned, obviously, monounsaturated fats are always considered to be healthy except for some recent questionable controversy. But you mentioned avocado, and I know that was a prominent factor in your studies. What got you interested in avocado in terms of its dietary benefits or lack thereof?
Yeah, so when we try to figure out the controversies with MUFA, and we found that the good resource of MUFA is really important. So there are some good plant source of MUFA, not the animal source of MUFA in Western diet. That is olive oil and nuts and avocados. And also there is emerging of high olive oil in the market, like safflower oil, sunflower oil, and canola oil. They are both high. They are all high in MUFA.
Did you have a particular interest in avocado in terms of as a source of monounsaturated fatty acids?
That's a good question. So in this good diet resource of MUFA, avocado is the only fruit. So and also avocado is relatively lower in energy density than oil and nuts, and there are only a few studies on avocados and cardiovascular disease risk factors compared to the high olive oil and olive oil and nuts. And also we think the controversies from the MUFA may due to source of MUFA they used in animal studies and human studies, because in Mediterranean diet like olive oil, they're high in MUFA, but they are also high in bioactive compounds like antioxidants and polyphenols. So we believe that choose a whole food approach to adding MUFA into the diet will also bring some benefit compounds into the diet.
Other
And
compounds, you mean like
yes.
antioxidants and things
Yeah,
like
and
that?
avocado is also high in fiber and phytosteroids. And one other important reason is there is no well-controlled clinical trial on avocados.
Okay, so very interesting. So there were 3 different diets. One was a relatively high-carb, low-fat diet, and then the 2 that had moderate monounsaturated fats, but from different sources. And what were you? Your endpoint was looking at LDL particle size. How did you?
Yes.
Was there any other endpoints, and how did you choose that as an endpoint?
So we measured all the established lipid-related risk factors of cardiovascular disease, like LDL, HDL, triglycerides, and VLDL, and also ApoB and ApoA1. And we want to measure LDL particle size is because it's an emerging risk factor of cardiovascular disease. And some studies showing the small dense LDL particles are more atherogenic than the large buoyant LDL particles. And also, people with small dense LDL particles pattern, even their LDL cholesterol level was controlled by statins, their risk for cardiovascular disease, and we call it residual risk, is still high.
Right, despite statin use. Were any of the patients in this trial on lipid-lowering therapies?
No, we are targeting a very healthy population, but they have potential risk. So our volunteers are healthy, free of any cardiovascular events, and not on any lipid-lowering medicals or supplements.
Okay, very interesting. So there were no confounders here. We were just looking really at the effect of those 3 diets on the lipid profile.
Yes.
If you're just tuning in, you're listening to ReachMD. I'm Dr. Alan Brown, and joining me is PhD candidate Wang, one of the top winners in the National Lipid Association Young Investigator competition. And we're talking to Lee today about her trial of looking at the effect of different components of monounsaturated fatty acids in a diet, or I should say different sources of monounsaturated fatty acids in a diet, as opposed to a diet that was essentially a high carbohydrate diet. So we've got a few minutes left, and I guess it's time to talk about the results of the trial. So I'm going to ask you to start with the results, and then when you're done telling us what the study showed, I'm going to ask you what you think the implications for public health are from the results of your study.
Okay, so we found all the 3 diets, low-fat diet, the high-fat diet, and avocado diet, they decreased LDL and total cholesterol. But the avocado diet did the best job in reducing the LDL and the total cholesterol, and also non-HDL. And low-fat diet raised triglycerides, VLDL, that is not good, and lowered HDL, that is not good either. But the 2 moderate fat diets didn't do that. And also, avocado diet decreased the ApoB, greater than the other 2 diets. And only avocado diet decreased small dense LDL.
So for those of us who love avocado, should we be eating 4 of them a day, or isn't that a lot of calories? So
our study is a weight maintenance study. So the number of calories were calculated for every volunteer to maintain their body weight. And our concept of this study is to substitute avocado to carbohydrates or saturated fats. In order to substitute the saturated fats in your diet, it's better to use monos than the carbohydrates. And when you think about which food should I choose to substitute saturated fat or carbohydrates with monos, we think avocado is better than just MOFA. So it will bring extra benefits to the diet because it decreased LDL more than the high MOFA diet, which has identical fatty acid profile. We matched the MOFA for the 2 diets. And also, only avocado diet decreased small dense LDL and lipoprotein remnants. Those are particles we think they are mostly atherogenic.
So on average, obviously people who are eating high saturated fat diets, it would make sense to substitute this. It should help their feeling of being satiated, right? Help reduce their hunger because of the fat content. But if someone in our audience has suddenly decided now they're going to eat a lot of avocados, what would you tell them in terms of what they should be eating? Should they have 3 avocados a day? Should they just substitute it instead of putting coconut oil or something in their food?
So at the beginning of the study, because we are in Pennsylvania, not many people eat avocados. We also have trouble like recruiting people who love avocados. Many people do not eat avocados. But in the diet, we give them recipes. We try to incorporate half avocado in the lunch and half avocado in the dinner, so 1 avocado a day. It turns out it's very easy to handle. And most people who do not eat avocados, like before the study, end up loving avocados.
Yeah, avocados are delicious. So really they're taking basically 1 full avocado a day, divided into half at lunch and dinner.
Yes.
And what did you remove from their diet? In other words, what were they substituting the avocado for? Give us an example. What would they normally be eating where you'd say, we're going to remove this and we're going to substitute?
Oh, okay. So, avocados substitute some meat and the fat in the dairy in the average American diet. That is our baseline diet. And also avocados, we use them to substitute some carbohydrates in the low-fat diet. So you can use avocados, substitute some bread. We even used some whole grain food in the low-fat diet. But it turns out avocado did a better job.
Yeah, and I would think substituting it for white potatoes would probably be very helpful from a caloric standpoint.
And even cut the total allergy from carbohydrates.
Okay, that's very interesting. So, what do you think the implications of the trial are in terms of our dietary makeup? We've been told, obviously, for the last 2 decades that we need to reduce fat in our diet and focus on low-fat diets, which I think has probably aggravated some of the obesity epidemic because everybody's eating very high carbohydrate diets and thinking it's healthy. If you could give us your thoughts on, what this study should teach us about how we should think about approaching diet and what we might do in terms of public health based on your results.
Okay. The first, I think it's definitely, don't have the bias that avocado is fatty because we know olive oil and nuts, they have been proved they are beneficial. So is avocado. Also, when you think about the food resource of monounsaturated fatty acids, it's really important to incorporate some whole food source like avocado, which also contains extra benefit. Avocados have fiber and phytosteroids and also antioxidants. And also, I think this study also bring us a very important information that avocado can decrease the particle size of LDL, and that's really important. We also found LDL particle size. The small dense LDL is related to a more atherogenic lipid and lipoprotein profile in our study. I think it's consistent with the some metabolic theories of small dense LDL, and also consistent with some prospective studies. They found small dense LDL is kind of a pattern of some risk factors like high triglycerides, low HDL, and also insulin resistance. And I think it's super important for diabetic patients.
Yeah, I'm sure you're right. Obviously, the small dense particles indicate that the patient has a lot of particles.
Yes.
The only dilemma is occasionally patients can have a lot of particles with larger LDL particles, and they're still at risk. So I have a little bias about particle numbers. But looking at the results of your data, the suggestion would be that there would be a reduction in particle number as evidenced by an increase in LDL particle size by switching a diet that has more monounsaturated fats compared to a high-carb diet. And of the options available, the avocado seemed to be the best option, right, for the source of monounsaturated
in
fat
healthy
acids.
subjects.
Yeah, in healthy people. Well, very good. Thank you. Congratulations on winning the Young Investigators
Thank you.
Award. I hope you continue to contribute to the literature on diet and nutrition, something we sorely need in this country. And unfortunately, we've come to the conclusion of this program. Lee, thank you very much for being with us today.
Thank you.
I'm Dr. Alan Brown, and you've been listening to Lipid Illumination, sponsored by the National Lipid Association. I'm ReachMD. Be sure to visit our website at reachmd.com/lipids, featuring podcasts of this and other series. And thank you very much for listening.